Hey guys, how are you? So guys, our today's topic is about the treatment of hypertension. So guys, before starting my lecture, if you guys are new to my channel, then please subscribe my channel and click the bell icon. So guys, before doing the treatment of hypertension, I have already discussed about its physiology and its diagnosis and its stages. So if you haven't watched the lecture of the physiology of hypertension, then you must watch that lecture before if you want to understand this treatment process clearly. But still, you can understand it. I will just do a little brief review of the physiology as well here. As you know, the blood pressure is equal to cardiac output into total peripheral resistance, and the systolic blood pressure depends upon cardiac output and diastolic blood pressure depends upon total peripheral resistance. So what happens in hypertension? Either cardiac output increases and systolic blood pressure increases, either total peripheral resistance increases and the diastolic blood pressure increases. So our treatment process is just to decrease the systolic and diastolic pressure, or we can say decrease the cardiac output and total peripheral resistance. So how we should decrease it? Let me first tell you about these antihypertensive drugs. I have made a full chart of it, so you guys can make a photo, or if you want this, these are all the antihypertensive drugs. There are no more antihypertensive drugs except these. Okay, so look, as you know, most of the diuretics are used as antihypertensive drugs. What are the function of diuretics? It excretes the body fluid out, most of the body fluid like sodium, water, everything. So these are the class of diuretics like thiazide, loop diuretics, potassium sparing diuretics, carbonic anhydrase inhibitor, and osmotic diuretics. And you might have seen many names like amiloride, spironolactone, mannitol, and furosemide. You must have seen furosemide a lot because furosemide is a very good agent. These loop diuretics are very good agent, and it is most preferred diuretics which are used because they can work in any condition. If the kidney is not so well, they can still work, because most of the person's kidney are not in excellent condition. So loop diuretics can work in on the kidney which is on any condition, so it is good. But if kidney is in a chronic kidney disease, if someone has chronic kidney disease, then the loop diuretics will not work. And you know, Aceinhibitor, what does it do? It blocks the angiotensin converter enzyme, and you know, angiotensin constricts the arterioles and secretes and helps in the secretion of aldosterone. And this one also angiotensin receptor blocker, so angiotensin can work. Renin inhibitor, renin is the cause of the secretion of ACE enzyme and causing the formation of angiotensin 2. And the beta blocker can block the beta receptor, and calcium channel blocker will block the calcium channel, and action potential will be less and the person's contractility will be less. And some drugs which are only used in pregnancy, methyl dopahydrolazine, and some alpha blockers, and some drugs in hypertensive emergencies like nicardipine, clavitipine, nitroglycerin, labetalol, all these. So we are not going to go in big detail of these. I will go in small details but not in big detail. If you want me to put a lecture on each of these or any of these drug class, then you can just comment in the comment section and I will put a detailed lecture on these drugs. So guys, what usually happen, for example, this is our heart. Okay, so what receptors are present on the heart? As I have told here already, we are being told beta 1 are present on heart, beta 1 is also present on kidney, and alpha 1 is present on the smooth muscle of the arteries. Okay, so here is the heart and beta 1 is present here, and here is our kidney. And which receptor is present here? Also beta 1. And what is present on the arterioles? Alpha 1. These are the receptors only which are present here. Okay, and what does kidney secretes when he finds that there is less sodium coming to them? It secretes renin. And what does renin do? Renin goes and converts angiotensin 1 into angiotensin 2. If you want a complete lecture on the angiotensin or the RAS system, then you can also comment in the comment section. It converts them under the enzyme ACE enzyme, angiotensin converting enzyme. And what does angiotensin do? It also acts on the adrenal gland and do what? Produces aldosterone. And what does aldosterone do? Aldosterone, it causes more retention. It increases sodium and water. So, and what is other function? Angiotensin 2. And what will angiotensin 2 is also doing? Angiotensin is constricting the arterioles. Angiotensin is first constricting the arterioles and is also acting on the adrenal gland. So angiotensin 2 has two functions: constrict arterioles, and what is its other function? Act on adrenal gland and produce aldosterone. So these are the main things: renin, angiotensin 2, angiotensin converting enzyme, alpha receptor, beta receptor, and other beta receptor. So our drugs will just act on these receptors or on these enzymes or proteins and will block them, so the blood pressure will come down. So as you guys know, the blood is coming from here, the cardiac output, and that cardiac output, when it comes from here and till the arterioles, with the pressure the left ventricle pumps the blood, that is cardiac output, and that is the systolic blood pressure. Cardiac output is the systolic blood pressure, and the resistance offered by the arterioles, you can watch the lecture on hypertension's physiology. In that lecture you can find the complete detail. I'm just doing a brief review here. And total peripheral resistance is produced by these arterioles. When the aortic valve closes, then the arteries and from the aorta till the arteriole, a pressure is produced, that is the diastolic pressure. So if someone's arterioles are constricted, then his diastolic blood pressure will increase, and if someone has more fluid volume, then his cardiac output will increase. Okay, so if when the renin is secreted, then it will increase the fluid volume, because it will first by aldosterone it will increase the fluid volume, and by angiotensin 2 it will do what? It will constrict arterioles. So if someone has some genetic abnormality and has hypertension, or due to some factors which might have produced atherosclerosis here in the arteries, and his arteries will and this receptor will work, alpha 1 receptor, or his or the beta 1 will work more, and he will have to pump more blood, then he will have hypertension. So when renin is secreted, it will increase the blood volume and constrict the arterioles. So the most dangerous factor is renin. Okay, so if we can block these renin or angiotensin or ACE enzyme or any of these receptor, then it will help. Okay, so if someone has high systolic pressure, cardiac output is high, the main thing is, even if we can't block the renin, we must do what? We must produce more secretion out of here. So even if renin is working, still there is more excretion of the fluid. So what we will do? We will use diuretics. Diuretics do what? It acts on the tubules, on the nephron, and it causes more excretion. Where usually the proximal tubule, distal tubule, these try to, and ascending loop of Henle. The loop diuretics acts on the ascending loop of Henle. So when we block the loops or the collecting tubule or the proximal tubule, then they cannot retain the sodium or water, and the excretion will go out and the body fluid will be less. So the systolic blood pressure will decrease, cardiac output will decrease. So this will only help in the controlling of systolic blood pressure. So we also have to control the diastolic as well. We also have to decrease diastolic. So what we have to do, because renin is still secreting, it is still secreting, and the alpha 1 receptors are also still working because of angiotensin 2, and there is also angiotensin receptor as well and alpha receptor as well. So if the arteries are not in good condition and alpha 1 and angiotensin receptor is also working, so there is a big problem. The arteries will keep on constricting. Even we give diuretics, only the systolic blood pressure will come down. We also have to get the diastolic blood pressure down. So guys, we will discuss more about the diastolic pressure in the next lecture. I hope you guys would have liked my lecture. So guys, if you like my lecture, then please subscribe my channel and click the like button. Okay guys, bye bye, see you.